Hi, Dr. Zweig. Welcome to Deep Into Sleep podcast.
Hi, thanks for having me.
I'm so excited. I think you are the first primary care doctor I ever had on the show so far who are really interested in sleep.
That's great. That's exciting. It's also disappointing. I think there should be more of us, but hopefully that's soon to come. But yes, no, it's really a pleasure to be here and a pleasure to talk about one of my favorite subjects.
Awesome. So how about you share with us some observations you encountered in your clinical work, right? So as a primary care doctor, do you see a lot of patients coming in with sleep concerns?
Oh, that's a huge part of what we do. I mean,
Wow.
it's really interesting because the way I got into sleep is because, when I started practice, I saw people with obesity and diabetes and high blood pressure, and a sleep clinic actually opened up upstairs from my practice, and so I went up there, and I realized the sleep clinics were opening up everywhere, and I started talking to the sleep doctors up there, and realized there's more and more research coming out about sleep apnea and sleep problems, and how those sleep problems are really related to a lot of the things that I saw on a regular basis. And the more I looked into it, and every time I turned around, I found another article that said, if you have high blood pressure, make sure that there's a relation to sleep. If you have diabetes, there's a huge relation to sleep. If you have obesity, there's very often a relation to sleep. If you have depression or anxiety or heart disease or, arrhythmias, or pretty much most of the things that I saw, very often you could relate back, at least in part, to a problem with sleep. And when I started asking about it with my patients, everybody said, yes, there's a sleep problem. And so I started really reading a lot more about it and getting interested in it, and realizing that as a primary care doctor, after doing this for 20 years, I'm actually not a primary care doctor. I'm a sleep doctor, because it's what I see when everything comes in. So it's really become a real big focus for me.
Wow, that's wonderful. I think you mentioned something really important, is that you asked your patient about sleep, right?
Oh, yeah.
I can imagine if a doctor who does not know much about sleep, they may not even think about that direction, right? They may not ask the question. And do you think that may miss a lot of information?
Oh, absolutely. Yeah, no, I mean, there's a big push to, or a lot of sleep specialists kind of consider your sleep duration, sleep quality to be what they call the fifth vital sign, along with blood pressure, heart rate, respirations, and temperature. That sleep is the fifth vital sign. It's just crucial. It's a huge and important part in everything that we do. And so I make sure that virtually everybody I see, especially if it's just for a physical, but almost across the board, I ask everybody about their sleep and how it is and how they feel during the day, how they feel the sleep quality is, what their sleep duration is. And, a good sleep history can reveal an incredible amount for your patients.
Yeah, so those kind of important sleep questions, are they included in a typical protocol in the practice so far, or just your practice been using it?
Actually, we do have a questionnaire that most people will come in when they do a physical. They do get a questionnaire, and they do what's called the Epworth Sleepiness Scale. And so, during their physical, before we see them, they have that completed. So everybody, there is a question about that, and depending on how they do on that, we should go into that further. So I think everybody here addresses it to some degree. I take it to the next level, I think, more than most of the other ones. But it is something that we learned here in my practice that is really important. So we make it a focus for our patients.
Wow, that's great. Yeah, I interviewed so many people, including a lot of patients suffering from different sleep disorders for years. Many of them told me it took them like 20 plus years to get diagnosed of certain sleep disorders. I was always amazed or surprised by that.
Mm-hmm. Yeah, it happens all the time, and like I said, you get somebody who's had high blood pressure that they just can't get under control with medications, or their obesity, or their depression, or their diabetes, or any of these things, and they've seen 10 doctors and they just can't get things under control, and nobody's asked them about their sleep. And, in 5 minutes, I figured it out that if you just, they say they're tired all the time, they snore terribly, their wife moved out of the bedroom because she can't take their snoring, and it's so obvious that it's sleep apnea, but nobody ever asked them about that. And so you can just figure it out in just a few questions. I think doctors in general are starting to get a lot better about that. I think we're realizing the importance of sleep and sleep disorders, and knowing that it's a really important thing to ask, because you don't want to just treat the symptoms. You want to get to the underlying problem. So if the underlying problem is a sleep disorder, that can solve a lot of the patient's problems and make them feel better, not just live longer, feel better. That's what we're supposed to do as physicians. And so it really is, I think, incumbent on all physicians to make sure that they ask that and address it if it's a problem.
Yeah, that's interesting. I think it's equally important, right? Live longer, feel better, be happier.
Right. Yeah, exactly.
And also have a happy bed partner.
Right.
Yeah. So how related those sleeping, like different sleep disorders to those, health complaints people have? You mentioned obesity, a lot of like heart disease, all the other things.
Oh, it's a huge, and there's all kinds of studies that, they say that the studies show that about 80% of diabetics, type 2 diabetics, have some form of sleep disorder. 80%. Wow. So you can almost say that diabetes is not an endocrine or pancreatic disorder. It's actually a sleep disorder. And there was another study that looked at 400 people who were over age 50. The only criteria to be in the study were over age 50 and depression. That was it. And so they looked at those people, they did a sleep study on them, and they found that 75% of them had sleep apnea. They treated the sleep apnea, and that's 75%, and the rate of depression went down to 4%.
Whoa.
A staggering, massively impressive result. So, and there's studies like that and all kinds of things that you can see over and over again, that the impact of sleep and how it has such a positive effect if it's going well, and it's such a negative effect if it's not. And so, so there's so many things that we look at as heart disease or kidney disease or an endocrine disease, and they're really a sleep disease at the most basic level.
Yeah, sounds like sleep disease related to not only physical health, mental health, right? Basically every aspect of our well-being.
Absolutely. Yeah. Even financial health. They found that people who get more sleep make more money. So I always tell patients, I'm like, whatever you want out of life, unless it's more TV, which nobody says that that's what they want out of life, and so for just about anything you want out of life, you name it, it will come to you more easily with more and better sleep.
But talking about that, that's funny. When I interviewed some entrepreneurs before, I feel like most of them are really pursuing less sleep, try to get up super early.
Yeah, and that is in the very extreme, the billionaires or the startups, and it catches up to them too eventually too, and it catches up to everybody. And there is a very, very small subset of people who can run on fumes all the time, but it catches up to everybody. There's virtually no one who really can manage without it, and the average person, the average Joe like you and me and everybody else, we need it. And so, maybe there are a few people who can, start their $1 billion startup at 25 years old and make it on 5 hours of sleep a night, but that is not the norm.
Right. And they accumulate a lot of sleep debt, right? I recently read some really funny things that when you're young or when you're energetic, you work so hard, sleep so less. Okay, you make a lot of money. You may make a lot of money, but then you don't live long enough to be able to spend those money.
Right. Exactly. Yeah, exactly. Yeah. Yeah, that's right. So if you're staying up late, I would say that the other thing is that, you only have a limited number of waking hours in your life. So is it worth it to use them up watching late night TV or watching Netflix, and especially if you do that, you also don't feel as well. So you're using them up early and you don't feel as well when you could actually, if you just go to bed, get your sleep, live longer, and feel better. And so overall, it's just, it's all the evidence shows it's just a better life. And we all know what it's like when we don't sleep well, when we wake up exhausted. It's hard to think, it's hard to enjoy things, it's hard to be present. It's just your body and your brain just doesn't work as well. And so it's a tough way to go through life chronically if that's the case every day.
Yeah, and without knowing
Without knowing it too. Yeah.
problem.
Yeah, right. You're right. Yeah, a lot of people just get used to it. Right.
Yeah, when you mentioned all these other, mental disease, physical disease, I was thinking, wow, if someone is obesity, right? They possibly, if they don't know, it's sleep issues underlying there. Then they take medications, they do all the other methods. It's not treating the target, and so the treatment possibly not effective.
Right. Yeah. And that's the other thing. I always tell everybody that, you can take medications. There's all these sort of quick fixes, but they're patches, without really addressing the sleep. The sleep is, the foundation to good health. I mean, diet and exercise are also important, but it's hard to get diet right. It's hard to get exercise right if you don't sleep. And so it's the cornerstone, the foundation of everything else. It has to start with sleep. And if you're not getting good sleep, all the antidepressants or weight loss medications or, diabetes medications or whatever it is that you're addressing, they might work and they can work reasonably well, but it's going to be hard for them to work well enough if you don't also have that underlying sleep to help jumpstart the system and get things going the way they should. And then you may not even need the medication if you do address it.
Right. And also I think that for all the quick fix, right? I don't think there's such thing for real quick fix. If they can fix your surface level problem very quickly, how long the effect gonna last?
Yeah, but everybody wants it.
When I treat insomnia patient, I noticed everyone just want medication, want me give them like boom, 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 3 method, so I can fall asleep immediately later night, and my life gonna be good forever, right?
Right.
No such thing. If you don't put effort in, you don't change your own mind, you still want to control your sleep. That won't happen.
Yeah, right. It's hard. It's a hard thing. Everybody's busy and they're frustrated when they come in. And by the time they come to the doctor, they're already exhausted and had a problem for a while. And so they just want to get it. They want it done now. And they're already at a point where, the less you sleep, the harder it is to do the things you need to do to get yourself good sleep. And so, we all get dumb late at night. The later it is, the dumber we all get, right? Because we're tired, and it's so much easier to just sit there and keep watching TV than it is to get up and change, brush your teeth, and get into bed. It sounds like a lot more effort and a lot less entertaining, but it's just so important. So, it takes a lot of effort to convince patients the importance of it and to get them motivated enough to do it the right way without going to the pharmacy without a pill first. And they're right. They all want an easy pill. They've seen all the ads. Everyone knows about Ambien and Sonata and Lunesta and all the medications that are out there. And they think, wow, this is an easy, great, wonderful drug that big pharma has given us. But they really are not good medications at all. They really just give you sedation more than sleep.
Right. Yeah. I think that's very important. You mentioned that it's really just to put you down in a way temporarily, right? Possibly with a lot of side effects. And then you still are not really controlling your sleep and you're still not sleeping well.
Right. Exactly. Yeah. You're out. And so it feels like you're sleeping, but it's not real sleep. It's not the sleep that you need, the deep stages of sleep. And so, it's more just, a drug induced sleep, which is, everybody knows what it's like when you drink too much. You're out for the night, but you do not wake up feeling good. Well, these drugs do sort of the same thing.
I like that analogy. Yes. I definitely have a lot of patients complain similar after effects. When they wake up, they feel drowsy and they feel awful.
Yeah, exactly.
Yeah. So what kind of problems people complain to you more? Have you noticed it's more like insomnia or suspected sleep apnea or a lot of sleep deprivation? Is there any different portions, or you just see
All
everything
of the
a lot?
three, I do see them all. I see them all a lot. I mean, insomnia is definitely the biggest one, and very much so during COVID. It's gotten a lot worse. A lot of people have been really anxious. Understandably so. A lot of people have been drinking a lot more, and so they have a lot of middle insomnia. They 2-3 drinks a night, and then they fall asleep great, but then they wake up at 2 or 3 in the morning and can't fall back to sleep. And so that's been a big one. Insomnia has been really a big issue always throughout my entire career, but it's definitely taken off during COVID. So that one is really an obvious one. Sleep apnea. Very few people come to me with sleep apnea. It's usually something that I tease out from patients. So if they have some risk factors or symptoms of things they talk about, I usually try to go a little deeper and ask them about snoring and how they feel during the day, and as a family history and all the questions you would ask about sleep apnea. Once in a while, I'll have somebody's spouse bring them in and say, my wife or my husband tells me that I snore so loud it sounds like a freight train, and then we'll talk about that and get them in. But usually sleep apnea is not something they'll come in for. It's usually something that I find after we've talked about whatever issue it is that they came in for. And then sleep deprivation. That's a common one too. A lot of people who say they can sleep when they're dead, and I always tell them it'll happen a lot sooner than you think if you take that attitude, or they have shift work disorder, or they just don't put the time in for sleep because they don't think it's important. So yeah, you see all kinds, and there's a lot of education that needs to be done about the importance of sleep. That I think the information's out there, it's just not disseminated the way it should be. So that's part of what I'm doing, and part of what this podcast is hopefully for, is to get to the right people so that it really understands how impactful it is.
Yes, to increase the awareness, right?
Yeah.
And from both the providers and the general public, hopefully everyone think on that direction more. So I think that's very important and great that you are able to, through conversations, you can help some patients tease out that, well, there's some concerning symptoms. Maybe you should check this out. Maybe you should consider a sleep study or something. Mm-hmm. Do you find yourself refer people out for further checks often?
Mm-hmm. Well, what I usually do, depending on what it is, but I'm a big believer in the home sleep studies. The portable sleep devices, or portable polysomnogram devices, because it's much more real world. First of all, it's hard to convince somebody to go to a sleep center. They don't like it. They don't want to go. They say they don't sleep well when they get there. They're required to lie on their back instead of rolling on the side or sleep in the position that they usually are in. And it's incredibly expensive. It's probably 10 times the cost of a home sleep study. So in most cases, I have just a home sleep study done, because the compliance of getting the test done is so much higher. Now they just ship it to their home, and then they do the test, and then they have the results after they ship it back. So it's a much easier, much cheaper test, and much more real world. And so there's studies that show that patients, if you do it that way, you have overall a much better outcome, because they're more likely to do it. Even though a home sleep test may not be quite as accurate as the in-lab test, it's more likely to get done. And so if it's 10% less accurate, but 20% more likely to have the test done, you end up at a positive. So I lean towards that, except for the few patients where it probably wouldn't be appropriate.
Okay, great that you mentioned that. Actually, myself did a home sleep study years ago, mm-hmm. and qualified for a CPAP machine. Mm-hmm. Unfortunately, recently my friends also are facing this choice. Do they have to go in lab or do a home test? The part of the reason is because it's really hard to get an in-lab visit. It's a long waiting period. Right. And when someone really will start worrying about their health, right, start really learn more about sleep issues, they want to get the test done as soon as possible. Mm-hmm. But at least in where I am, San Francisco Bay Area, everywhere is a long waiting list.
Mm-hmm. Yeah. Well, it's funny because there was a time where all of a sudden there was one sleep study center and then another and then another, and within like a year or two, all of a sudden there was one on every corner, and you get one in a day or two. And then we found as these home sleep centers started coming around, I'm sorry, the home sleep studies started getting more and more popular. Now they started to close more and more, and now it's getting harder to get the in-lab studies again. And part of it also is from an insurance standpoint. A lot of times it's hard. Insurances will require a home study first before you can do an in-lab study, unless there's a very obvious reason for the lab studies.
So if any of our listeners are interested in getting a home sleep study done, what's the procedure? Do they need to go to a primary care doctor like you first, get the referral or something?
So it depends on how comfortable their primary care doctor is. I'm very comfortable with ordering it, and so I have no problem with it. A lot of my colleagues tend to refer somebody out because they aren't comfortable with reading the results. And so I always tell them they can bring them to me, and I'd be happy to read them. But it's not a very hard thing, but it does take practice. And I've done it a lot, so now I feel comfortable with that. But so their primary care doctor would have to be comfortable with it. I think that's happening more and more. A lot more primary care doctors are starting to order the sleep studies themselves rather than referring people out. But it's a very physician specific thing. So they'd have to ask their primary care doctor, and then they'd either go to a sleep specialist, or the primary care doctor would ask them themselves. Order it themselves, and it's very easy. You just fill out a form. The physician fills out the form and sends it into the company, depending on which company they use, and then about 5 to 7 days later, the device shows up on their doorstep, and with all the instructions, they put it on, they sleep with it that night, and then mail it back the next day or two, depending on how many nights they're supposed to use it.
Oh, interesting. Sounds like very straightforward.
Right? Yeah, it's really great. Yeah, it's a big step forward in medicine.
Right. I heard more and more people are doing that, or more doctors, patients are choosing that over the COVID, since the reality, right, is it was not very safe to go to in-lab study.
Oh, that's right. Yeah, that's another one. Right, exactly. I was doing that way beforehand, so I haven't seen a big change. But that makes perfect sense. Yeah.
Yeah. Well, your practice sounds like very advanced. Like long time ago, you already started doing all this. Wonderful.
I'd like to think so. I don't know.
Possibly benefit a lot more patients that way. Yeah. So just to clarify, a patient cannot just go ahead, order a test by themselves. It has to go through a doctor, right?
That's the idea. Yeah. Now it also, a lot of dentists are doing it as well, because a lot of the dentists fit the mouth devices that pull the jaw forward, and so dentists have gotten into it as well. And so there's a lot of dentists that order it, some there's good and bad doctors and good and bad dentists. Some have the right training and some just order them. But I've actually gotten a lot of patients that have come to me because their dentist ordered the home sleep study, and it was abnormal, and so they referred them to me, or they tried the dental appliance and it didn't work, or they didn't tolerate it, and so they came to me as the next step. So so there's a lot, like I said, there's a lot more awareness out there than there used to be.
Right, that's great. But it sounds like not all the doctors who refer patients to there can read the results and help the patients explain what the result means. I know a lot of these tests, they come up with a report, but nobody explained that. Right. So for patients, if they are not familiar with sleep field, those numbers could look really strange and new to them.
Right. Yeah. And there could be a lot of scary things on there that they'd say, if you have an arrhythmia, this might be wrong, or might suggest an arrhythmia, and then they get nervous about that, even if it's not there. Or, there's depending on how the report is written, it could be daunting, or it can be scary. Yeah. So definitely make sure you interpret it correctly.
Yeah. So let's see if dentists refer some patients to you for the next step, what are some things you normally could help them with from a primary care point of view?
Yeah, so a couple of things. The gold standard obviously is the CPAP, Darth Vader mask, and so that's gotten a lot better because now they have something called AutoPAP, And it used to be at CPAP, you could only figure out the C stands for continuous. And so you would have to titrate the pressures in a lab to figure out what the appropriate pressure was. But now they have these auto PAPs, which instead of continuous pressure, they have auto PAP is a continuous flow, where sort of the machine makes sure that there's constant flow of air depending on what the pressure is. So it'll adjust the pressure to make sure that the air continues to flow. And so the nice thing about that is you don't need to titrate it. And so in the continuous pressure, it assumes one size fits all, and it depends on how tired is the patient. Did they have something to drink that night? What position are they in? What happens if they gained weight or lost weight? What if they're in stage 3 and REM versus stage 1? And all those times need different pressures. And so the auto PAP adjusts for that. And so, I used to find myself sending people back for CPAP titrations after they lost weight or gained weight, or they didn't feel like it was working as much. And with the auto PAP, it's a big advantage. They don't have to do that anymore. So that's been really nice. Some other things that obviously we mentioned, the mandibular advancement splint or device, the dental appliance that can pull their jaw forward and pulls the tongue away from the back of the throat. And that is another good device, usually for mild or moderate sleep apnea. It doesn't work as well for severe sleep apnea. And those are the two main ones, as well as weight loss. I mean, weight loss is the big one. If they're overweight, not everybody's overweight with sleep apnea, but if you're overweight, losing weight can make a big difference in your level of sleep apnea. It can make it less or even go away. So those are the things that I usually address. Once you go from beyond there, there's a dozen other things they can do. There's tongue stabilizers, and there's the Inspire, which is the pacemaker for your palate, where they surgically implant an electrical device. And, there's all kinds of other things that are out there, the nasal valves surgery. And so you can do a whole lot of other things, but that really weight loss, CPAP, and the dental appliance are the main approaches that I use.
Great to know. Sounds like depends on how severe you are, right? There are a lot of different options you can do, and can go to doctors if their doctors are trained or with a lot of sleep knowledge, then can really help them navigate all these options. Or else, as a patient, I would imagine that's going to be so confusing. What should I do exactly?
Right. Yeah.
Right.
Yeah. Another fun one that's come out, and I don't know if you've seen this much, but there's some evidence now that just doing some mouth exercises and breathing exercises actually can help, especially with mild or moderate. There's nobody out there that really teaches it, or there's not any respiratory therapist or physical therapist or anybody that around here that really helps teach the patients that, but there's some handouts and things that we can give them that can also help. And that's sort of exciting because it's free, not so hard, and reasonably effective.
Right. I actually heard about that. I'm not sure whether it's the same thing, but I heard from parents, since I treat children also clinically. Some parents told me their younger children got diagnosed with sleep apnea, and then they have specialized speech therapists teach the children to move the jaw and do some kind of practice with their mouth every single day. But that sounds very painful, because that practice and teaching gonna have to last for several years to make a long-lasting change to their airway and tongue and all the other positions. So at least from my patients, sounds like a very big burden for both the parents and the children.
It is, right. Yeah, it's hard to get people to do their exercise and things they should do, but it's a nice option if they can do it. And so, at least it is something that is simple and cheap and can work. So.
Yeah, something to consider, right? I think every treatment option, again, there's no easy quick fix. We all have to put effort in to do some work.
Right, exactly.
Yeah, but it's good to know about the auto PAP. I think the CPAP I got was the CPAP. I definitely find adjusting the pressure all the time is very exhausting, and you have to find the right doctors to do, especially I have family members in China who need that, and they could not find doctors to adjust it because sleep disorders, sleep treatment are not very popular there yet.
Mm.
So I'm wondering, is the auto pipe something you can just patient can just buy on their own, or is need a prescription from a doctor?
Well, actually, it's hard to get anything right now because I don't know. You're probably aware of the Philips recall. You've heard about that. There
Yes,
were
I
some
heard about that. I
over.
did not dig
Yeah.
into it. I was
Mhm.
surprised when I saw that. They are such a
Yes.
big brand.
Well, they're one of the two top brands,
Right.
and so because of that, they had to have over 2 million devices were recalled
Oh,
because of a filter that was off-gassing a mildly toxic chemical, but but if you use it over time, it turned out to be a bad thing. It was very small, but but something that should be recalled. But as a result, right in the middle of our supply chain dysfunction, that 2 million devices get recalled. Now it's been so hard for my patients to get devices. So it's been really hard. But you can, under normal circumstances, yeah, you can get whatever you want on Craigslist, or you can go, there's a place called cpap.com. They can go and they can buy it themselves. You'd have to know what pressure settings you need, what size mask. And I mean, so it's sort of difficult. And obviously insurance isn't going to cover it if you order it yourselves, but it
right.
would if you get an order from the doctor. But yeah, they can go and get their own machine. And for people who don't have insurance, that's what I tell them sometimes is look on Craigslist or try to get a used machine if you can find one, because it's better than not having anything. But yeah, it's hard to get machines right now.
Oh, wow.
Yeah,
Okay.
yeah,
Yeah. So, on one hand, we find the problem, we recommend the treatment options. On the other hand, how to get those treatments. There's
right.
always barriers.
I
I
know.
heard barriers like have symptoms, from symptom to get a diagnose, right? That's a huge barrier already. And then from diagnose to find the right treatment is another big barrier.
Yeah, it is, and it's frustrating because now the patients who already have their CPAPs are being told these machines cause cancer. It's incredibly small. It's something like 1 in 8,000 people if you use the device for 3 years. So it's an extra 2 or 3 years. I can't remember exactly what that was, but it's an extremely small risk. But if you're the 1 out of 8,000, it's not so good. And it's scary to use something that you're not supposed to use. But the other option is to not get adequate sleep. And so, they're kind of stuck and they're all in a holding pattern with waiting for the machines to be replaced. So, it's anxiety inducing for a lot of my patients. And
Mm.
it's frustrating not being able to get them the device they want.
Right, right. A lot of decisions have to make, right?
Yeah. Yeah.
Yeah, and especially I know a lot of people with sleep disorders tend to worry a lot, especially if they have some kind of insomnia
Mhm.
problem in the picture.
Right.
They already start worrying about their health too much. They worry about how sleep may impact their health. Now they know there's a chance for me to get cancer. That's
Right.
horrible.
It is horrible. I know. Yeah, it's tough. Then we're the ones that had nothing to do with it, but we're left holding the bag and trying to explain what the patient needs to do next. So it's challenging. Yeah.
Right, right. So I know your practice has a lot of different services,
Mhm.
right? What do you find really helpful to incorporate in your own practice to really help all the staff, all the providers understand the importance of sleep and really incorporate sleep aspect in all the like medical treatment?
Like I said, one of the things we do is we always ask a sleep questionnaire for everybody who's getting a physical. So I think that's really helpful. And then the other thing we do at our practice that we started during COVID that we've decided to continue with now is we have a town hall once a month where we do a Zoom meeting. And, we started it just to give our patients the opportunity to ask us questions and to hear about the latest with COVID so we can help allay some of their anxieties. And as things went on, everyone got sick of COVID. We ran out of things to say about it. And so we used it as an opportunity to move on to just educate our patients around whatever the topic that we wanted to talk about was. And so we've had a few of our town halls about sleep now, and it's been great. And I think that's really a great way. Doctors always have specialists coming in and talking to each other. We teach each other through grand rounds and journal club and all these other things that we have where we teach other doctors. But this takes it, instead of having them come and just teach the doctors, it goes to the patients too. So it's a nice collaboration with specialists around us and with what we do, and then also to help teach the patients and show them the importance of sleep, or whatever the topic is that we're bringing up that month. And so that's been a fun addition, and a nice addition that we've had in the last couple of years.
Oh, okay. That's wonderful. I think it's a very great opportunity for the patients to have this chance, right? To really see different providers, ask all kinds of questions. That's not easy to do.
Right. And then they can chime in. They can ask questions too. They don't have, usually people don't have a lot of opportunity, and you only have if you only have a quick visit, to the regular doctor or the specialist, they not usually able to ask a lot of questions. And so this gives a great opportunity to educate the patients about whatever it is they might be dealing with, and let them ask questions about it too.
Right. So there's another question I have observed actually from my friends recently. Several of my friends, they all get pregnant, and during the pregnancy, they all end up having this hypertension, right? So I was wondering, I think I read some literature a long time ago about pregnancy, sleep problem, and your blood pressure, all blood sugar level, all those different things. So I'm wondering, in your practice, to your knowledge, whether there's any link there, and for pregnant ladies need to really be more cautious about.
Oh yeah. So there's people who have hypertension. You're getting a little bit out of my area of expertise now. I don't see a lot of pregnant women. They go to their OBs usually, but certainly there is hypertension in pregnancy. But the more concerning one is that they can have preeclampsia, which is a dangerous condition that's hypertension and can result in kidney problems and other things. So they should get their blood pressure checked regularly. Anybody who's pregnant, and I've not seen anything about preeclampsia associated with sleep disorder. I wouldn't be surprised if there was, but I'm not aware of that. But certainly, yeah, I mean, when you're pregnant, heartburn and just back pain and big basketball in your belly, it's hard to sleep. I remember when my wife was going through it, and she'd wake up at 2 a.m. starving, and I'd hear the crinkles of a little candy bar, and she'd eat next to me and eat that too. So it's hard to get sleep when you're pregnant. So that can certainly affect your blood pressure and many other things.
Right. Yeah, great. So near the end of the show, there's if our listeners want to learn more about your practice, or if they want to seek your help, how can they find you and your practice?
Okay, yeah. So we are in Alexandria, Virginia. Our practice is at Northern Virginia. It's Northern Virginia Family Practice, and the website is nvafamilypractice.com. And you can go on there. You can see a blog that I write under the name of Ounce of Prevention MD, and also see our town halls and see how to get in touch with us if you'd like. So please check it out.
Wonderful. Do you have any last wisdom to share with all the audience who are listening, no matter they are providers themselves or they are, curious general audience?
I think the big thing is that, medicine, I would say medicine is not that hard. You have to exercise, eat right, and get plenty of sleep. And if everybody did that, I'd have a lot more free time. There would be a lot fewer patients in my office. And so, it all starts with sleep. You can make sure that you're getting at least 7 hours of sleep a night. And if you do that, like I said, there's everything in life should improve.
Wonderful. Yeah, that reminds me of that old saying, one apple away, keep doctors away, right?
Right, yeah.
I feel like it should be 10 more minutes of sleep a day, keep doctors away.
Exactly. That's right. That's actually a great statement. Yeah, you're right.
Thank you very much for coming
you.
and sharing all this with us.
I appreciate it. Yeah, it's a lot of fun. I appreciate it.
Thank you for watching our videos or listening to our podcast. If you like our show, please feel free to subscribe, like, and share it. If you have any questions or feedback, we would always love to hear from you. You can either email us or leave feedback on our website at mindbodygarden.com. or directly under the YouTube video channel. Thank you very much for your company today, and hopefully to hear from you or have you with us next time.